Radio. You can connect with diverse communities and target audiences in these regions.
Community engagement partnering with iRadio means engaging with communities at a grassroots levels. Your message will resonate with listeners in various locations, fostering meaningful interactions and driving brand awareness.
Comprehensive coverage with stations in strategic locations like Reng, Malakal and Baliet. iRadio offers comprehensive coverage that reaches both urban centers and remote areas. Your partnership with iRadio ensures visibility across a wide geographic area.
Don't miss out on the opportunity to amplify your message with iRadio. Partner or advertise with us today and make your voice heard across South Sudan.
Welcome to the Sundown Show. On this show, we bring you the movers and shakers of South Sudan and the world over. We engage in debates and discussions that unearth the stories behind the news. And we have our light moments too by chit-chatting about issues that affect our day-to-day life. Stay right here on the Sundown. Join in and be part of the show on iRadio, your eye on South Sudan.
أهلا ومرحبا بكم في برنامج سانداون على آي راديو. في البرنامج ده بنستضيف شخصيات بارزة ومؤثرة من جنوب السودان ومن حول العالم، وبنتحدث معهم عن القضايا اللي بتهم بلدنا وبتأثر على حياتنا. كمان بنتطرق في القصص خلف الأخبار وبنتبادل الأحاديث الخفيفة عن حياتنا اليومية. شاركونا، كونوا جزء من البرنامج فقط على آي راديو، عينك على جنوب السودان.
Hello and welcome to the Sundown Show on iRadio with me, Madrama James. We kickstart this program by discussing on the dangers of cervical and breast cancer, a serious illness that, if left untreated, can spread through the bloodstream to vital organs such as the bones, liver, cancer, lungs, and brain, ultimately becoming life-threatening and fatal. On November 6th, Mission 21, a faith-based health organization in partnership with the National Ministry of Health, launched a baseline survey on breast and cervical cancer in Juba Central Equatoria State. This study aimed to evaluate the level of awareness and prevalence of these cancers among women aged 18 to 70 in the city. The survey targeted over 2,000 women from Juba Block, Munuki, Luri, Payam, Kator, Rajaf, and Kondokoro Payam, and ended in that December. Additionally, on December 12, 2025, the organization, together with government officials and partners, held a one-day workshop to validate the finding of this assessment report. To shed more light on this serious matter, iRadio invited that Kabuye Gerard, lead consultant, and Dr. McCoy Samuel, co-lead, and then we have Dr. Thomas Tongun, lead investigator, not forgetting Mr. Lonal Mambo, also representing the acting country director. First and foremost, I would like to start by giving this chance to Dr. Thomas to briefly tell us about some of his findings during this survey. Good to have you in the studio and welcome.
Thank you, James, for the invitation for us to come and give you the findings of the study that we have carried out in Juba here. Overall, the findings illustrate two markedly distinct information ecosystem. Women primarily depend on radio, churches, health workers, community gatherings, where men have greater access to television, the internet, and digital platforms. Regarding knowledge, awareness, and risk perception, basic awareness of cancer is high. The majority of the respondents, about 81%, have heard about cancer. 91.5% of breast cancer and only 74.7% of cervical cancer. Women, despite being at the greatest risk, were less aware of cervical cancer than men. Almost half of respondents, that is about 43.7%, knew someone personally with cancer. Most often breast or cervical, showing that cancer is now a familiar reality rather than a distant concept. However, awareness of where and how to seek services was much weaker. Nearly half, 48.7%, did not know of any facility that provide cancer diagnostic services, and 78.2% did not know how far the nearest screening center was. Many reported that people with cancer are treated outside the country, reflecting gaps in local oncology capacity. Knowledge of risk factors was partial and uneven. Most respondents recognize smoking, that is about 73.4%, and alcohol was 69.1% as cancer risk, and many link unhealthy or chemical foods to cancer. But understanding dropped sharply for biomedical and reproductive risks such as obesity, family history, HPV infection, early sexual debut, and multiple partners. Uncertainty was high, with large proportion answering "don't know" on several items. Traditional healing was rarely recognized as a risk when used instead of screening or treatment, reflecting deep trust in herbal and faith-based care.
All right. Now, let me invite Dr. McCoy. If you are to analyze this report and summarize it to that our listeners, what does it mean? Does it mean South Sudanese are still lacking behind when it comes to issues or awareness of that cancers? Number two, what does it really entails to some of our grandmothers, old, young girls that are also deep in the villages? What does this report particularly mean to them? Welcome.
Thank you very much. So I think from the findings, it clearly illustrates the fact that there is high awareness on the prevalence of cancer. The issue is that there is very, very varied levels of awareness on the risk factors and where to seek care. Not only care, but also where to seek the diagnostic interventions. So you can see clearly that the fact that the awareness level on risk factors create a situation where people sometimes unknowingly get engaged in practices, lifestyle that actually exposes them to ultimate preponderance to cancer. But of course, the fact that we also need to underline here is the fact that within the country, cancer is definitely seen and understood as a growing health concern in the country. But then, because of the low infrastructure in the health system to be able to provide diagnostic and also to provide care and to provide awareness also at the different levels of care, even at the community level, health workers may not also be so conversant on educating patients on the risk factors, and that by itself contributed to the very low awareness on where to seek help, even though there is definitely the growing concern that cancer is a real problem. And of course, it only happens at the time when people are diagnosed at the very late stages. There's definitely very high fatality, case fatality for cancer because of late diagnosis. And that, of course, raises a huge concern. The impact on people's understanding that cancer is a big problem.
At the start of your statement, you talked of lifestyle that equally contribute. What are those lifestyle, briefly, before I invite Gerald?
Yes, so for instance, you have consumption of locally brewed and refined alcohol.
To better.
Exactly. So that contributes definitely. I think every weekend people go and booze, and I think this consumption of alcohol contributes to that. Some foods, okay, identified. For instance, the way at the community level, for instance, most of the communities identify as farmers, and the way when they harvest, the way they keep their food produce, also creates a situation where they, for instance, for groundnuts, and you have aflatoxins, and this definitely contributes also to cancer. So, and then of course, maybe if I can just jump into some of the things that cancer also has a very huge impact on the community, especially the fact that it's stigmatized. And that by itself creates a situation where people sometimes will prefer to suffer in silence because of maybe the fear of the cancer, the stigma around cancer itself, but also seeking help becomes an issue, you see, because people will not go to seek help very early, and they prefer to go maybe to herbal treatment, which doctors and these other...
Sorry for interrupting. People thought the stigma only exists on issues related to GBV and HIV. Why cancer this time around, before I invite Gerard?
Well, first of all, because many patients in South Sudan diagnosed with the cancer are diagnosed at the late stage. So, and people, when somebody is diagnosed with cancer in South Sudan, it's like a death sentence. And that by itself comes with a stigma. So because of that, I think the need for awareness for people to know that actually if people can go for screening and cancer is diagnosed at the early stage, and people seek treatment, you can actually get cured.
All right. Now, Gerard, before I invite Mambo, would like to invite you to let us know, or our audience know, how will really someone know that is having a cancer? More especially, let's talk about cancer more in women, and because you are the lead consultant, then later on I will also invite Mambo. Welcome.
Yeah, thank you so much. I appreciate my colleagues, and I wanted to do some small points of emphasis, and one of them is that when you look at cancer, people's knowledge is high. Actually, 81% have heard about cancer, and then around 91.5% they have seen a person with cancer from all those that we interacted with. So the awareness is there. But there are some impending factors, like you talked about alcohol, you talked about smoking, whereby all those that we interacted with, at around 73.4% know that smoking increases the risk. Around 69.1% know that alcohol increases the risk. But when it comes to practice, it's different. And the reason is, I think the level of awareness of people regarding cancer is still very low. It does not support them to begin taking cancer as a serious issue. And the reason also is, by the time you realize cancer, it's in advanced stages. You know, when you look at the report, it says that people only confirm cancer when they see wounds, when they see excessive pain. These are all things that come at a later stage. So I think all those contribute. But also when you check on cancer, there is one result that we looked at, and we said that around 10% of the 2,310 respondents who reached out, they were confirming that 10.5% they think cancer is a curse. So it answers one of the questions that you asked Mr. McCoy, that what could be the issues around this? You know, when it comes to stigma, people fear to go to hospital because the moment you are confirmed a cancer patient, people look at you as a curse to their family. That's one. Two, people tend to because they don't know the idea of handling cancer, they don't know the idea of staying with the cancerous patient. Therefore, they distance, they excommunicate, they put you aside. You are left alone. So it's better to be with my cancer when everybody doesn't know, when I still receive when I'm still embraced within the family. And there are many other factors also that contribute to stigma. For example, when you look at the aspect of like in our families, you know, one of the respondents was sharing with us that even men, when they confirm you have cancer, there's a very high likelihood that they will go for another woman whom they think could be more active, could be more safer. They look at you as already a dead person. So I think these are all things that we need to fight as we who are fighting cancer, to ensure that we avoid this. There are also other things that possibly hinder our ability and capacity to progress in terms of preventing and fighting cancer, like the aspect of cost. Almost 60-point-something% of those that we interacted with, they say the cost is high, they cannot afford it, they can't go for cancer, even screening becomes a problem. But also on the other hand, also combining it with lack of knowledge is the fact that, you know, how can I call it? Many people are not aware. When you look at self-examination of breast cancer, you just do it. Do it yourself. Check your breast. You ask your husband to check. I mean, it is just within you. It is with you. You're able to do it. But people don't know this, such that they're able to do because for them, they know you have to go through a formal process of screening, the testing vigorous, something like that. So there's a lot of lack of knowledge among our communities to understand how to handle cancer is concerned.
Now, Gerard, if that's the case, based on your expertise, what are some of the earlier signs of the cervical and breast cancer?
And breast cancer. The number of signs, of course, some of the signs go as far as, of course, those extreme pain that can be experienced around the reproductive system of mothers. There are the aspects of, sometimes we get abnormal discharge from our private parts, for example. You begin getting abnormal discharge. But also in advanced stages, we also experience anomalies in terms of our. It also sometimes disorganizes our normal reproductive system. Maybe for ladies who go for monthly periods and whatever, it also tampers with that normal structure. So the number of signs that can really communicate and show. But also the other most critical thing when it comes to breast cancer. Breast cancer is, in most cases, it begins as a simple lump within the breast. And when you keep checking the lump, in most cases, it keeps changing. So it is important that whenever a mother, whether young or old, I've seen girls at the age of 25 and 26 who have gotten breast cancer, and they have been treated and they have cured, actually. So it is important that you check as a mother, you see if there is any anomaly within your breast, and that could be a sign that you must take care of as soon as possible.
Finally, if you are to rate 1 to 10 out of the baseline studies that you people have carried, what specific information do you have at hand if you are to rate maybe a 1 out of 10?
Maybe I may have to get that information, that question clearly. You're saying if you are rating ourselves
based on the study.
Basing on the study.
Yes. In South Sudan here, if you are to rate 1 to 10, what is the
at a scale of 1 to 10?
Exactly.
What is the prevalence
of people having that breast and cervical cancer?
Cervical cancer. Yeah, when you look at our study, the prevalence is around between 15 and 20%. That's what it would say. But the only difference is that when you look at people who have experienced cancer, those who know those who have had cancer, the experience is high at 91.5%. So that means at least a person has seen a cancerous person, either within the family, from the neighbor, or within the closest friends. So when it comes to the really existence of cancer, is below 20%. But when it comes to people who have experienced it and seen somebody sick, they are 91.5%.
All right. Donald, thank you for coming as well. We would like to know from you why did a faith-based organization and partners decided to take this lead and launch a baseline study in South Sudan, more especially Juba.
Yeah, thank you, James, my technical team for the wonderful work. As mentioned before, Mission 21 is a global community partner church organization based in Basel, Switzerland. Also with office in different continents, 4 continents: Europe, Africa, Asia, and Latin America. Purely working through church organizations or churches. Based on the need, because we have the thematic area on health that is done through different partners like PRDA, South Sudan Council of Churches, and other church member churches of the Council of Churches. So the study was deliberate. It was taken because through our health component, we realized that cancer per se is a neglected area. And moreover, there are a lot of patients suffering from cancer. So the research or the baseline survey was done to establish a basis for programming in terms of intervention in the health sector, so that we can be able to support the national government of the national, state, and the county health departments in trying to see where the organization can factor its components or intervention in the areas of health. Of course, with the recommendations that have come out very clearly, we have said already, we did some validation with the different stakeholders, including the Minister of Health, the National Minister of Health. We also invited a technical team from different health background, oncologists, pediatric, from that perspective, the different experts. They have added their voices to this report that will give us basis for better information to inform our programming in the health sector, and also build information, because looking at different data across different websites of the National Ministry of Health, there are gaps, lack of information about what has been mentioned by Gerard and the team, and therefore there was a need, ultimate need, to have a basis for our intervention. Yeah.
Thank you. Let me invite Dr. Thomas. Were there some surprising or unexpected trend during the baseline survey? One of maybe biggest surprise that the team has so far encountered? Welcome.
Yeah, thank you once again. Generally, the survey went well, and we found cooperation from the site locations that we have identified in Juba County and Juba City Council. But unfortunately, there are some areas that we found it difficult to assess due to the leadership which are there. The leadership have high demands that we cannot really meet, and as a result, we have to leave those locations, and then we have to opt to another location so that we cannot so that we can really meet the data that we need to collect. So generally, the challenges is just some of the leadership in those areas, they are not really cooperative, and they have high demands. As you know, the situation of Juba is not good. So they see an organization coming as a source of support or source to supply them with something that the organization even doesn't have. because we have limited budget for this program, and so when we went to certain locations, they search for a long for high demands, and so we have to leave that one. So I think that is the only challenge that maybe we have. But I can invite my lead consultant, Gerald, also to add a voice to that.
Well, thank you so much. You know, this research is very interesting because we realize that around 56.7% of those that we interviewed, which is approximately 1,400, they were saying that one of the other challenges is women have to seek permission to go for treatment from their husbands. I mean, this is a health issue. Do I need to come to James and say, please, can you allow me, you know, I'm sick, let me go and be treated? I think that was something very unique. But on the other hand, we are also agreeing that they're also agreeing that at least men should support their wives in this issue of cervical cancer and breast cancer if we're to have success. And therefore, programmatically, one of the critical things we need to put in mind as we move ahead is to ensure that every step we take, men are behind us and supporting us for us to have a success. That's one unique thing that I saw, which was very interesting. I can't seek permission to treat myself.
Now, how will the information collected influence, you know, a policy or healthcare practices in South Sudan, Gerald?
You know, when we're doing any research, there are global practices, the World Health Organization practices and procedures, the ethical considerations that are globally recognized. One of the global recognized ethical report is Blue Monde report. So we made sure that even when we're doing data collection, we consider those guidelines and regulations globally, regionally, as well as at national level. And therefore, we had to go through the normal procedure, because it gets back to how do you select the respondents, how do you recruit the respondents, how do you seek consent from the respondents. So we never missed any of that. But one of the most critical things, as we see the global trend of today, we have the aspect of inclusivity, and our research had more emphasis on cervical and breast cancer, therefore had more interest in the women, and therefore agreed at our plan that we need at least 70% of the respondents to be women, so that we get more details in as far as cervical cancer and breast cancer is concerned. But also the mere fact that men are also critical in influencing decisions within the households. We had to approach 30% of the men. However, when it came to the report, we approached around 75 point something percent of women, and then around 24 point something percent were men in the overall. So we had to consider that. But also, for us to be inclusive, the inclusive part of it globally is also emphasized. We had to include in people with disability, children with disability, and people with any special vulnerable conditions. So our data collection was inclusive. It was overall looking at men and women such that nobody is left behind. But also in the process, we made sure that for those who know better these issues should be the professionals also to some extent. The leaders at state level, national level, at county level, but also those who are working within the hospitals. Most critically, there are these frontline workers, those who receive patients, who listen to the patients every day, were very important to consult, because they knew the day-to-day challenges they face in as far as handling these cancer issues. I don't know whether that is enough to respond.
Thank you. Dr. McCoy, over to you. Let's talk about how to prevent cancer. This issue of infrastructure in the country, and at the same time resources are not really in the hands of many citizens. Now, when is the right time to tackle cervical and breast cancer in women?
Well, if I can say, respond to the question when, it should be yesterday. Why? Well, because there are a number of reasons that I will come to it, but before that, let me try to rewind back to the surprise about this, the findings. Personally, when I went through the report, I was sort of really surprised to realize that even though generally there is anecdotal data on cancers, but the awareness level from the responders is very, very high. And also I was surprised that even when you cascade the data down, you realize that men are more aware of cervical cancer than women. That was a big surprise to me. Okay. And before I get to responding to the main question, I also wanted to note the fact that when we look into the pattern of cancers, especially women, breast cancer is a big issue. Cervical cancer is a big issue. In male, you have prostate cancer, which is a big issue. Liver cancer, of course, both. But the issue with the liver cancer, of course, is very important to note that there are these infections that could actually be prevented, especially the issue of chronic hepatitis B, which is actually the main contributor to liver cancer. And people are dying as a result of that. And then there is the human papilloma virus, which is actually contributing to cervical cancer, which actually can be prevented. And this now comes to the fact that we are dealing with an emerging health concern at a time when our capacity to do the diagnostic, do the awareness campaigns, provide preventative measures to protect people from these diseases are still to be developed. Now, one of the things that I want to highlight here is the fact that, again, related to the cancer, is that to the survey, is that this actually is the first, I believe, the first survey that has focused on knowledge, attitude, and practice in relation to cancer, and specifically on focusing on breast and cervical cancer. So it becomes a very important tool. It is timely, and the good news is that as of 2005, the Ministry of Health has already taken real steps to institutionalize care through its first dedicated government department for cancer diagnostic and care and treatment, the Juba Teaching Hospital. Now, it is important also to note that this just few weeks, I think a week ago, 2 weeks ago, we concluded the health summit. I think it was a very national event. And the health summit has definitely prioritized cancer as a major priority that require the attention of the government to make sure to provide informed policies to make sure that resources are dedicated to address not only cancers but also the myriad of other diseases that are together called as non-communicable diseases, which is actually contributing to more death than deaths from the common diseases. So yes, we need that response yesterday, and I think the government is already providing that attention in moving forward to ensure that cancer care, diagnostic, capacity for diagnostic, capacity for training of health cadres at all levels, and also the capacity for treatment within the country has to be one of the priorities that will inform decision moving forward.
Thank you. Now, I would like to ask Mambo, and later on, Gerald, you'll also add on something. Before coming here, I tried to do some research about statistical accurate information or reliable information about data of that cervical and breast cancer, but those informations are not there. Those accurate figures are not there. Now, how can government, partners, and community leaders collaborate together to address this burden of cervical and breast cancer in the country? Because once if reliable or accurate information is not there, that's already an issue. So first to you and to Jared as well.
Thank you so much, James. As I said before, this assessment was done deliberate because we're also aware that we don't have concrete information data, for example, on website, different platforms to really use it as a basis for programming. So we already have conversation with the Ministry of Health. We have conversation with University of Juba, the Department of Public Health. They have very good skills in terms of making this information relevant, having it on website, also on the side of the government, so that we have publication in terms of having this information locally, nationally, and even globally. And it will also be, of course, as mentioned before, is a kind of fast survey that is in place, that is done. We want to make sure that it is very clinical. We screen it very well with all these different departments so that we have very clear information currently that will be available. Two, this is the journey. We're starting to partner, specifically in the area of cancer, because it is an isolated area and we have full information about all this, and then we are not doing anything. So we decided to do it deliberately so that we have an action point right here moving forward, supporting the government. And you're also aware that we have different facilities around Juba, but we don't have information. Probably we also don't have better capacity for them to have response. And so as at the organizational level, we'll sit back and use this document to generate a programmatic approach in response to either creating massive or more awareness, or finding what gaps as an organization we can join hands to fill it up. Of course, we'll also come up with an action plan in detailing roles. What is that needs to be done by government? What is that needs to be done by partners? What is that needs to be done by communities themselves? What is that needs to be done by households? And then eventually we'll have solution to this effect.
All right.
Lastly, at also our different coordination meetings at different clusters, health cluster, for example, this has to be tabled. That is a major concern, because I read the recent humanitarian response plan for next year, and I've not seen cancer as key priority. So this has to be discussed even at cluster level to make sure that in our programming for next year we have cancer issues as priority.
Gerard, how is the absence of reliable or accurate data creates a burden in tackling the issues of breast cancer? In less than 2 minutes, so that we also give chance to our patient audience to ask their good questions.
Thank you so much. Absence of data creates a gap that can't easily be addressed. Globally, nationally, regionally, county level, state level, you can never plan without data. If you know you have 20 people, you know how much medicine they need, you know how much money they need for proper planning. So it's a big burden, really. But I think in my own perspective, as one of the players within this research, we shall have to go by what my colleague Ronald has mentioned of publication. Publication, we shall do some other level of analysis, especially bringing in regression, comparing what influences what, such that people have more of the learning aspect. That one is very key, and we have agreed actually with all the stakeholders that we must do publication. That's one. Two, we shall also, if resources allow, if partners, donors allow, since cancer is one of the non-communicable diseases that are posing a threat currently to this country, it's important for us to begin thinking of how best can we do a country-wide survey that would give us the best. Yes.
I saw Dr. Samuel nodding. What are you really agreeing with Gerard? Briefly, before I invite our audience as well.
Well, I think he emphasized on the fact that without data, you are driving blind. So I think data is very critical to inform evidence-based decisions. If we are talking about government prioritizing cancer care, and then you need data. If we are talking about allocating resources, you need data. If we are talking about which particular cancers you need to build capacity on, you need data. If you need to be able to come out with intervention messages, you need data. So yes, data is an issue. And I think we want to thank Mission 21 for taking the most important first step, which actually energize everybody and it stimulated people now to start searching for data. And I hope it will not end with this one.
Let's hope so. Dear listener, up to here, it's your time now to grab that cell phone and dial our studio line on 0911022986 and 986 and Ninagad bin Nakish in Saratana Bezata Alfi Nasawin but Fasilatu Wale.
It's a Baghdad Diamond Wenisuma iRadio ala numrata telefon 0911-986-986 au itabiresilu risala ala numra 0913-986-986
na kudawal mukhalama radio
Madrama James.
Ustaz Tolfuk.
Absolutely, this is me Tolfuk. I greet you and I greet guess what in the studio.
Thank you.
And I greet all the listeners and regular scholars across the South Sudan. أنا بشكر الضيوف بتاعنا وكمان الإدارة بتاعكم والإدارة بتاع أي راديو لأنه بيجيب لنا الناس نلقى معلومات فوقهم وكمان نلقى المعلومة ويكون معلومة تجيب ومعلومة مكفينة. بالنسبة للبروجرام أننا قاعدين نتكلم فوقه يعني بروجرام ده بروجرام جميل بروجرام الفوق بتاع هيئة بتاع الإنسان هذا تماما. ده نسأل سؤال بسيط سؤالات بسيط. أول حاجة أنتم ناس النساء المستشفيات أنا ما قاعد المستشفيات معلوم مستشفيات الدوات ما في المال دوات بيجيبوا بتاع شهرين 3 شهور وبعد أسبوع دوات ما في المستشفى كامل وانتم قاعدين تشتغل بالحكومة. الدوات الناس تشتغلون هل الناس دي عندهم مرتبات ولا لا؟ نمرة 2 الزول لو انت تلقى الزول يشتغل الدوات في المستشفى العقوبة بتاعه شنو؟ ده 2 3 زي اللي انت اي زول يشتغل بالديبارتمنت بتاعه وفي الزول في ليدر وفي ديبتي. as انتم قاعدين في الاستوديو ده شغل بتاعكم عشان تجي في الاستوديو تتكلم عشان زي شغل اورنس. هلا انتم قاعدين تمشي في المستشفيات عشان تشوفوا العدد الشال على الدوار ولا عدد ماشي على حاجه. هل انتم قاعدين تمشي خلوا الناس خلوا الستاف ده انتم زي الزول المسؤول لانه زول مسؤول لحد ما تمشي المال الشغل عشان تشوف الشغل ده يمشي كيف.
شكرا.
انتم قاعدين تمشي.
شكرا.
في النهايه المعلومات اللي هنا قاعدين نتكلم زي اننا سيتيزن. انتم قاعدين تشيل حاجه فوقه لانه انتم قاعدين تجي في اي راديو تقول لهم هنا قاعدين نشتغل ده وده وبعدين ما في. هل هسه الناس اي راديو كذابين ولا انتم؟
شكرا. The Ustaz Tolfuk, whether you people are making a good use of some of the information you're getting from the community. That's, I think, one standout question from all the rest. Hi, Radio.
Hi, Radio.
Now.
Madam Jones.
Yes, sir.
Mr. Abgar.
Mr. Hanur.
Yeah, so thank you for doing the doctors في اي راديو. ففي كلام تاع كانسر انا بتكلم انا قلت حكومه بتاعنا بتاع جنوب السودان.
ما ابدا باسم بتاعك وتصل من وين عشان تجيب بتاعي بعرف.
Okay, thank you. So I'm calling Mr. Bingo Joseph from Godali Kuji. So انا بتكلم في كلام تاع كانسر في ساوث السودان. فكلام تاع كانسر في ساوث السودان هسه دول كان عمل له كيسز قالوا عنده كانسر ما بيشيل له 3 يوم ولا 4 يوم زول له خلاص وعنده تراما وشنو خلاص هو بيموت. فأمم كذا دكتورز بتاعنا بتاع ساوث سودانيس ويال بتاعنا بتاع جنوب السودان ما في إمكانيات لهم عشان بقدر بيروح بواسط بتاع كوميونيتي بتاع ساوث سودان عشان براجب الدواء بتاع كانسر وجا كوتو في مستشفى حكومة زي كان لقوا في نيروبي هم عنده سنتر كانسر treatment. Ita kan ja fi Uganda Kampala. Umanando cancer center treatment. Lakini lina fi South Sudan ini hajadil ana mutaakid kadan hakuma bitona mabagder bufakir anu muatmin bito. Lakini mun kazes doctors wada ya haja lu waduma sanmun biragara asan bija saido abo bitomun ako bitomun uma bitomun abo bitomun. Umun mabagder bamolo kaze doctor union umun roa imala laga jibo data cancer ijibo ikoto fi South Sudan asansa donas.
شكرا.
Yeah, it too. It can show other the rate of the death done better than Saba laga the wasl sarit nasar de it can show rate bita mutu kan muda kan jama better than Saba laga sarit nasar kan bada bedri ana mutakin nasar South Sudan kan inta. Wa umun kaze doctors zai yal bitena te junub zayal bita belede amolo surveyors ligu gal muskila de shunu alga katol nafta junub Sudan de ziyada de shunu.
شكرا.
So the house wal bita ana udilumun bin non kof yal bita junubin wa ana junubi ana ma bagder بخوف عشان كلام بتاع ناس. شكرا.
شكرا دينجو ليتا بخاف في الحقيقة. نعم نبدأ توالي بالدكتور وكمان ثماس يالا سايمون ماكوي فرصة عليكم.
يا زاهر شكرا للناس اللي اتصلوا عشان بسألوا عن موضوع كانسر لنا بونس وفقدام. فأنا ممكن ببدأ بسؤال الأول تزول كان بدأ كلام تا drugs تا أدوية في المستشفيات. قال أدوية بيطلع من المستشفى وشغل تنا بقول شنو فوق كده. فأنا داير أقول له كده برنامج حقنا هنا ده أنا بونسو عن موضوع كانسر وعن دراسة عن كانسر لأن نعمل قريب ده وأنا بيجيبوا نتيجة تو لناس. أنا ما بونسو كلام تا دوايات في المستشفيات. ده توبيك تاني كبير براو الدير يوم تاني براو الناس كمان بيجونسو عنه. لكن على أن بونسو ده اسمه ماجوكا عنه
ده
تلفوك أن بونسو عن موضوع كانسر ونتيجة تا دراسة لأن نعمله لأنه يعني أن ده عارف هل ناس في جوبا هنا هل من بعرف موضوع تا كانسر. ففي دراسة اللي نعمله ده اللي جو بينه ناس كتير عرفوا عن موضوع كانسر. ده حاجة كويس كاليس اللي نعرفه ومناه بعد ما عرف حقهم ده مناه دير شغل تاني ممكن أننا ممكن بيجا فكر فوقه بعد هسا عندنا نتيجة معرفة كانسر في جنوب السودان هنا.
دكتور سامويل تلفوكس على السؤال كويس كاليس معلومة بتا سافي بان مرات هو دي مثال ناس برا في كوميونيتي بيشيلوا معلومة لكن أخيرا انت ما بعرفوا يستعملوا معلومة دي كيف. This time around information albezadi tumeelga min community zaman bita survey de tumura istamilu kif.
So survey da in the recommendations البمشي للستيك برا فمعلومة في السرفي ده بيساعد حاجات كتير. بيساعد في البوليسي ديفلوبمنت، بيساعد في الموبيلايزيشن تاع ريسورس كحكومة ذاته وتوظيف تاع ريسورس ده ممكن يساعد مشكلة صحية معين. بيساعد برضه في التوعية تاع مجتمعات وبرضه بيساعد الأكتس في هيلث سيكتور عشان كيف ده أول سيرفي يتعمل في البلد عن كانسر. وأنا متأكد كل هيلث سيكتور حسي أكتر بيحاول عشان يستفيدوا من المعلومة الحسن متوفرة بواسطة السيرفي ده. فأنا دليل نأكد لأخونا السؤال سؤال بإني يعني معلومة تلا من السيرفي ده معلومة مرغوبة وده معلومة بيساعد الحكومة في ترقية الصحة بالذات عشان إنه يشوف كيف يبني القدرات في كل المستويات الخدمات الصحية، وكمان بيساعد ذاته انه الهيلث سيكتورز بيساعد في توعية the community.
All right. Dingo, I said, for instance, in Uganda, Kenya, there are cancer centers and they also drug for it. Are we equally replicating that here in South Sudan, Mambo, to say that maybe Mission 21 is coming up with that initiative of setting, a cancer center in the country, because you have partners as well?
Thank you so much. It's a big question that requires. I'll try to answer small, because from the reliable information that the government has moved forward, there are facilities that have cancer screening services that is available in Juba. For children, Al Sabah Hospital, there's also one in Juba Teaching Hospital. Probably there are gaps that needs to be looked at. So the basis of this information will help us plan together with the government, like Dr. McCoy has said. This information is relevant for us as the first step. The second step is their recommendations based on what is practical seen on the ground and what needs to be done. So this requires discussion with the government, discussion with our headquarters, discussion with different health partners on the ground, so that we plan resources accordingly.
Thank you very much, Gerald. What are the next steps following the validation workshop to translate these findings to tangible health improvement in less than 1 minute?
You're worried over me, I can see. No, but most critically, which I wanted to comment on the questions, one of the questions was, why our people die instantly? As soon as we discover cancer, then they die. The answer is simple. We discover cancer at the advanced stage. So the most critical advice here is discover cancer early. It's curable. It is something that can cure. I have people, close friends, relatives who have cured out of cancer. Now, getting back to your question in terms of what next, from the discussions we've had with the Mission 21 and with the different stakeholders, the government, because we have been doing this thing together with the government, the state government, the national government, the county authorities, health authorities, we have agreed that come January, now that everybody has set their mind for Christmas, we cannot disturb people now, but come January, we shall have to have a joint planning to develop an operational plan which we shall begin implementing 2026. That will guide us who should do what, who should support where, and whose role is this, and then we move on together.
Thank you, dear listener. Up to here, officially we have come to the end of our conversation, focusing on the survey done and the validation workshop recommendation.